Welcome to Doctors at Work. My name's Matt Daniel, and this podcast is about doctors' careers. It's part of my mission to help doctors create successful and meaningful careers. Today's episode is about perfectionism, and I'm having a discussion with Greg Chasson, who tells me that perfectionist tendencies can be useful, but when they get in the way of good patient care or in the way of a good career, they can be a problem. At the core of perfectionism is about excess expectations and rigid thinking. In this episode of Doctors at Work, we talk about how perfectionism shows up in clinical work, and we discuss some ways that we can help ourselves and others. Welcome, Greg. Tell me a little bit about yourself.
Happy. Thank you so much for having me. I am a licensed clinical psychologist and board certified cognitive behavior therapist. An associate professor and the director of behavioral interventions of the Obsessive Compulsive Disorder and Related Conditions Clinic at the University of Chicago Medical Center. That's a mouthful, but essentially it means that I handle all of the behavioral treatments for anybody with OCD or even remotely close to OCD that come in, staff, students, community, a lot of physicians come in for treatment. So I see a lot of it. And part of the obsessive compulsive disorder family of conditions includes perfectionism and fear of failure, which is one of my areas of expertise and one of my passions, quite frankly. And as I'm sure you can imagine, at a place like the University of Chicago, there's a lot of it. I have it coming out of my ears. And so it's an area that I've really been focusing on for the last 20 years in both treatment and theoretically and research-wise.
Yeah. And I'm particularly interested in perfectionism, and I know that's what we're going to talk about today. And maybe a good starting point would be what actually is perfectionism?
Yeah, great question. I think there's a lot of misunderstanding about perfectionism. Most people are unsure what it is, or they think it's a good thing for the most part. In fact, they might use it in a glib way as an answer to what is your greatest weakness in an interview. In reality, perfectionism is pretty damning. It's pretty paralyzing for people that experience it. It's on a continuum. So some people have a little bit of it, some people have the opposite problem, but the people that I see in my clinic are absolutely devastated by it. It means that individuals experience two primary features that tend to work together in a fairly negative way. And those two features are cognitive rigidity, sort of the inability to shift your mindset, difficulty with switching lanes and pivoting when necessary, just essentially perseverating on ideas and thoughts and being unable to move away from those. The second ingredient is excessive expectations. And so there's sort of what many people would consider normal or normative levels of expectations, and then there's perfectionistic expectations that go beyond that. These are more than just high expectations. These are excessive. Now, really, those two things in isolation aren't necessarily huge problems. The real issue is when those two things interact with each other. And so perfectionism really are those two things together that create a situation where people are pursuing excessive goals that are totally unreasonable, and then they have a very hard time deviating from that because of that rigidity. And so you just see somebody essentially hitting their head against the wall constantly and not being able to understand that that is not the path forward. And so that really is the best way of understanding perfectionism, which is different than high expectations, because you can have high expectations and still be flexible in your thinking. You know, for the person that loses a point on an exam and gets an A instead of an A plus, that with somebody with perfectionism, that's devastating. For somebody without perfectionism, they're able to not necessarily enjoy that they lost a point or like it, but able to recognize that that's not that big of a deal and that they gave it a good faith effort and that there are lots of reasons that that could have happened.
I'm interested in understanding that a bit more, and let me kind of give you one of my examples. So, I work as a surgeon, and every now and then we have complication. I know it sounds shocking, Greg. So,
Yeah.
it happens to all of us. But let's say somebody who's a surgeon, or somebody who's a physician, and they make the wrong diagnosis, or somebody who works in emergency department and they send somebody home when that person should have been investigated. I think for most of us as healthcare professionals, that's a pretty devastating event when it happens. So let's kind of work with that example. So what's the difference between what's okay? So if I have a complication and then I do a lot of soul searching and I'm annoyed at myself because there's a complication or I made a mistake, what's the difference between kind of where's an expectation realistic and where's an expectation excessive? As a surgeon, I expect that I'll always have a good outcome. I'm always going to deliver the best that I can in my patients. Okay, I think I'm answering my own question here, aren't I?
Yeah, yeah, it's a fair question because there's actually not an easy answer. It really depends on the circumstance and the profession. And this probably doesn't surprise you, Matt, but I see a ton of surgeons in particular in my clinic, and a lot of them are struggling with perfectionism, and it usually goes the opposite direction. And this is what I mean by it really depends on the circumstance. So I have surgeons where the patient is open on the table way longer
Okay.
than is reasonable or healthy or is just frankly dangerous and completely unnecessary because the person is so scared about making a mistake, doing everything perfectly. And so it ends up costing more risk in the end than had they just sort
Yeah.
of done as best they could in the first place. And so I think that is one way to think about it is, are you becoming so behaviorally stuck or slowed down that it's actually undermining the principle of why you're so
Yeah.
worried in the first place in terms of making a mistake? I think of the example of something, I know we're talking about perfectionism, but I think it's easy to see in the world of obsessive compulsive disorder where someone's worried about contamination and they are washing their hands so much to disinfect their hands that they end up creating dried and cracked skin,
Yeah.
which actually makes them more susceptible to infection and getting pathogens. So it's really this irony. I call it the irony problem because if your patient's on the table for 8 hours and it really is a 30-minute procedure, that is a
Yeah.
huge problem.
Yeah, yeah. I do have colleagues like that as well, Greg. So, but actually, I like that idea that what's the result. So if I have a complication then if I do a lot of soul searching and I do a lot of thinking and reflecting and I see what could I have done differently, that from what we're discussing, okay, that might give me a hard time and it might be difficult for me, but that's not perfectionism because actually that's a good thing for the patient, or at least for the next patient, if not for the first one that had a complication. But okay, so I mean yes, that idea where people get paralyzed by fear. So this excessive expectation, there's fear in there, or people are afraid that it's not going to go. So what's the relationship between fear and perfectionism?
Oh, just a tremendous amount of relationship. There's a huge overlap. I would say at the core of most perfectionism is a fear of failure
Okay.
and fear of letting people down, imposter syndrome, all of these things. And when you have huge stakes involved, either huge malpractice lawsuits or more importantly, someone's life at stake, that fear is just kindled like crazy. And so it makes total sense that the physician profession is at huge risk for something like perfectionism. You also see a lot of really high achievers with perfectionism. So it's not shocking that there's probably a higher base rate of perfectionists among physicians.
Yeah.
And it's the thing that when I talk to organizations and doctors and when I give talks to teams, and really the thing I think that surprises people is that perfectionism, first of all, is under recognized, but second of all, it's generalized a lot of the time. So one way to really help yourself as a physician is to understand, where is this perfectionism hitting, not just in the operating room, not just in these clinical moments, but also, is it slowing down my note writing? Is it slowing down my ability to reach out and do follow-up care? Does it get in the way of me communicating with my consulting physicians and peers? So does it get in the way of me filing for insurance for those that are, so there are lots of areas where it can get in the way. And that is where you need to really check in with your values, what's important to you and your profession, about how to prioritize. I mean, that's to me at the heart of a lot of this. So I call it the emphasis framework. It's in one of the chapters of my book in the book Flawed, which is a leadership book on perfectionism. And it's an emphasis framework in which there are three emphases I describe: emphasis A, emphasis B, and emphasis C.
Mhm.
Emphasis A is an approach where you give it your all, 110%, everything you got.
Mhm.
This is for things that are essentially very important to you or to society or whatnot. So this could be you studying for your entrance exam into medical school. Maybe that's really important to you, so you want to give it your all. Maybe you're planning for your wedding because that's a very important family and life event, right? So you give it your all. Then there's emphasis B, which is the get her done strategy. Just get it done. It doesn't need to be garbage, doesn't need to be beautiful, it just
Yeah.
needs to get done, right? Just give it an effort. And then there's emphasis C, which is don't do it at all,
Yeah.
right? Just skip it. Now you might think, emphasis C sounds bad. Emphasis A sounds good. Actually, I'm agnostic to the judgment around this because
Okay.
there's an actual adaptive reason to use all three of those in different situations. Emphasis A makes sense for, again, the things I was describing, but emphasis C makes a lot of sense for a lot of things that don't connect with your needs or values and they're not important to you. So I give the example of not answering those customer service satisfaction surveys at the end of my, customer service call with the Verizon or AT&T or whatever,
Yeah. Yeah.
And so I basically just hang up and, I get that they want my information, but I just don't feel like that's worth my time and resource.
Mhm.
So really it's a strategic use of emphasis C that's really critical.
Mhm.
Now, in reality, the problem with perfectionism is that people with perfectionism emphasis A way too many things,
Okay.
almost everything,
Okay.
right? They think they can emphasis A everything, and in reality, that's impossible.
Mhm.
And most people that have a healthy sort of way of navigating and a flexible way of approaching tasks, most stuff is emphasis B. They just get it done. And then
Yeah.
they really, really use their values to really identify what they want for emphasis A, and then they go to town on it.
Yeah.
Here's the problem though with perfectionism. If you're trying to plan A everything, it's not possible. So things end up getting pushed off. And this is why procrastination is such a huge problem
Yeah.
with perfectionism, is that it gets pushed off. And then ultimately those tasks turn into plans,
Yeah.
emphasis C, instead of your values choosing emphasis C, it's your perfectionism choosing emphasis C. And so really it causes a lot of issues. And you see a lot of procrastination, a lot of shame, a lot of guilt, a lot of essentially getting in trouble at work. I can't tell you how many doctors I've had who can't get their notes done and are so far behind that they feel like they can never catch up.
Mm.
I mean, it really is a serious problem. And it's because they're trying to emphasis A, their notes.
I hope you're enjoying the show. Please click subscribe so you'll be notified when new episodes become available. This podcast is part of my mission to help doctors create successful and meaningful careers. You can be part of that mission too by forwarding this show to one person who you think might benefit from listening. Thank you. Now on with the show. So, Greg, how do I as a leader recognize that somebody in my team has an issue with perfectionism?
Yeah, it's a great question. I get that a lot. And I also get the question is, should we not even hire them in the first place? So
Okay.
uh, let me first answer that one just because I know everyone's on pins and needles. Absolutely. Please do not, this is not a witch hunt. Please do not remove people with perfectionism from the workplace. They can be some of your strongest workers that you have and some of the most passionate and caring. And I think that would be a huge mistake. And so I would suggest instead that if you can recognize it, that you work with them to try to help them minimize some of the problems that it might cause, give them some tools, information, and then you actually work with them to maximize all the great stuff that can come with it. And I'd like to explain a little bit about that, if you will. Perfectionism is not all bad, and I want to make that very clear. Now, I personally don't think that the good stuff that comes with it requires them to maintain all the bad stuff that comes with perfectionism.
Okay.
So I think you can work on the perfectionism and not lose all the great stuff that comes with it. But some of the great stuff includes Loyalty. Some of the most loyal people you'll ever have are perfectionistic. Conscientious. I got to tell you, if there's one thing I would want in any employer, team member, or colleague, it's conscientiousness. Heck, if I'm on the table open and a surgeon is conscientious, I'm feeling pretty good about that, right?
Yeah. Yeah.
They tend to be the most honest individuals in the room. So if I really need someone to tell me what they're seeing and the truth about it, sometimes the perfectionist is going to be your most honest.
Mhm.
Very much going to be the most detailed oriented person in the room,
Mhm.
right? So if your team relies on a couple of its members to really focus on the details
Mhm.
rather than the big picture, your go-to is going to be a perfectionist. And I think that your team needs to have some of those people in order to balance out the big picture thinkers. I also think they tend to be the most industrious. And this is not necessarily uh, a trait that they were necessarily born with, but that they've developed over time because they've basically done 3 times as amount of work as everyone else to keep pace because of all the plan, the emphasis-ing that they've been doing on everything. So they're going to be your hardest workers in the room. And so, in general, I think these characteristics are completely worth dealing with perfectionism because of how amazing they can be. Now, but the perfectionism, how do you identify it? I think that was the original question. There are lots of ways. I think the number one way in my book is to look for what's called safety behaviors. Safety behaviors are the behavioral response to the anxiety,
Mhm.
the fear of failure, the anxiety over being judged, the fear of getting fired, the fear of killing a patient, fear of misdiagnosing. These are all things that a physician might feel, especially if they're perfectionistic. And they'll do things to try to ameliorate or calm that anxiety in the moment. So that instant relief is a very powerful reinforcing agent. So an example of this might be tons of reassurance seeking or
Mhm.
tons of checking behavior
Mhm.
or frankly procrastination. I brought this up earlier, but that's the number one,
Mhm.
probably the number one safety behavior, and avoidance behavior and escape. So if
Mhm.
you're getting a physician that's constantly seeking reassurance
Mhm.
beyond what is normative, and that might have to change based on their developmental level, right? If they're a young physician, they might seek more just in general. But even then, you can tell, is this more than what would be typical for someone at that stage of their career? And
Mhm.
so if they're constantly seeking reassurance, hey, does this look okay? Did I do this Whipple correctly? Did I, all of these things? And you're thinking this person has asked this before, or they continue to ask this question and they should know this by now. And they seem to just be needing reassurance.
Yeah.
That could be a sign to you that they're really struggling with anxiety and fear of failure.
Yeah.
Um, I think checking behavior, if they're constantly checking and rechecking whether they've done something correctly and going back to their checklist of what they need to do in the surgery room and then going back to the patient and kind of going back and forth and checking constantly and then asking other people to check for them. And I mean, it can really become a problem. That's an example of somebody who might be perfectionistic.
Yeah.
Somebody who is concerned about being an imposter is often a sign of perfectionism. Now, I think everyone has some level of imposter syndrome. In fact, I'm kind of scared for the person that doesn't have some level of imposter syndrome. It's really a matter of degree
Yeah.
and how often it's a problem. So I think every time there's a career transition for somebody, there's going to be some imposter syndrome, right? So you get promoted, you're going to be a little bit imposter like for a while. But
Yeah.
if you're feeling this in a pronounced way for a long time and in a situation in which you've been doing this a while, I
Yeah.
think that's a sign that there's some perfectionism there.
Yeah. Okay. And I'm wondering, how would I know if I have too much perfectionism? Would be sort of exactly the same things that you've described, or is there anything else internally that I might notice in myself that would suggest that I have a problem with this?
Yeah, I mean, it is this some of the stuff I suggested are the things that you are more readily able to see in other people. Behavior is always easier to see than something else, like internal things like thoughts or emotions. But if you're feeling a ton of imposter syndrome or fear of failure,
Yeah.
if you feel a lot of urges to do some of those behaviors I said earlier, like calling in sick to avoid a meeting because you're worried about looking like you didn't do something correctly. Now, of course, that's not a big deal if it happens once or twice, but if this continues as a
Yeah.
pattern, but if you tend to be highly indecisive and you're struggling to make a decision, that could be an indicator.
Yeah.
because you're worried about making the wrong decision.
Yeah.
Um, if you're having what's called a not just right experience, this is a very common situation for people with anxiety and perfectionism, is that they need to do things until it feels or seems just right. And so they'll just keep doing things and fixing things until it gets to that feeling. And if you get stuck in those moments, that could very much be an indicator of perfectionism. Again, that rigid thinking, if you're somebody that has a hard time pivoting and being flexible, changing your problem solving strategy, even though you're getting all the data in the world telling you that what you're doing isn't working, and maybe even being called stubborn on occasion, maybe that could be an indicator that you're perfectionistic.
Tell me a bit more about rigid thinking, because you started off with that in the beginning. You called it cognitive rigidity. What do you mean by that? And can you give me some examples?
Yeah, cognitive rigidity is essentially, like I said, just an inability. It's a meta level concept, meta thinking, metacognition, where you just are, your tendency is to keep thinking something and being unable to pivot no matter what's in front of you.
Mhm.
So you could continue to, I'll give you an example. So you're giving a presentation at a conference
Yeah,
and something happens, right? Like the projector doesn't work, or your clicker stops working, or
yeah, yeah, yeah,
stuff happens,
yeah.
right? We've all been there. I once showed up at a conference and realized that they didn't have any computers there, and I didn't bring my laptop, and I was a grad student, didn't know better, and so I had to go up there and give a talk with nothing. It was a good learning opportunity. Talk about fear of failure, right? Uh, so the things happen, and if that were to happen and you had to pivot in the moment, and let's say you had 10 minutes instead of 30 minutes to give a presentation because of something happening, somebody that is really rigid in their thinking and perfectionistic might feel like they have to go 1 through 10 or 20 on their slides in order in the same way that they had sort of prepared.
Yeah.
Whereas somebody who's more fluid or flexible in their thinking might be able to skip over an entire section on the spot and say, you know what? That's not part of the big picture. It's not that critical,
Yeah.
and then they'll skip around. They'll go to, slide 15 and say, look, if we have time, we'll go back to slide 2. I don't know if you've ever seen this, but sometimes people just feel like they have to march through
Yeah,
their
yeah,
slides. And that to me is always like, that feels very much like this person's got some rigidity.
yeah, yeah, yeah. I often see that in if you're talking about that presentation, when people are running out of time, and you see you've got another 5 slides to go, and you think you're running out of time. Just pick the one slide you want to talk about and ignore the rest. But people sort of religiously go through the next one, don't they? And they don't see that actually. Okay, I've got 1 minute. I've got time to do one slide. Let's pick the one slide where that's going to be most important.
Exactly. In fact, that is a great example. I've often thought of that example of giving somebody that task as
Yeah,
an assessment of perfectionism to see, like, here's 5 minutes,
yeah.
give me a slide presentation, and let's see how this goes. And I'm going to tell you to skip and see how much that makes you squirm.
If that's in your next research paper, Greg, sort of, I want credit sort of
Yeah.
for coming up with that idea jointly.
Yeah. Chasson and Daniel et al.
Exactly.
Exactly.
Well,
Yeah.
I don't know. I don't need to be included in a paper. Just credit in,
Acknowledgements. Yeah.
an acknowledgement. So okay,
Mhm.
okay. So we talked about perfectionism, and I like this idea that there are tendencies in that actually are admirable and very productive and very good to have, and then sort of somewhere along a continuum, difficult to describe where it becomes a problem because instead of being a behavior that serves you and the patients, it's a behavior that doesn't serve you and it doesn't serve the patients. And that kind of, I know it's a continuum, but there's a concept on either end. Is this behavior useful? Yes, it is. Is this behavior not serving me and my patients? No, it's not. That's a distinction that's easy for me to understand. I mean, what can we do about it? I know you've talked a little bit about stuff from your book about how people can change their thinking around this, but I'm interested in if you could tell me a little bit more about what people can do to deal with it.
Yeah, so I think part of it is just understanding what perfectionism is and getting that education. And then I think the learning how to navigate priorities with that emphasis framework. Um, one area that I think I like to address and I haven't covered yet with you is this idea that people with perfectionism tend to get stuck on rules, even when it undermines the underlying principle of those rules. And I give a stupid example just because I think it helps illustrate. If you are at a community pool and children are playing, and you're sitting there and a kid is drowning in the pool and no one is there immediately to help them, and you think I could run and help that kid right now, but running near the pool is against the rules. And oh, I just ate. I'm not supposed to go in the pool. It says it on the little, poster in the front of and the kid drowns. You basically have just you're abiding excessively by rules at the expense of the underlying principle, which is pool safety, right? Like it makes no sense. I know that's a ridiculous example, but that kind of thing happens all the time,
Yeah.
especially in medicine. And the example I give on this one in medicine is what we see at the end of life and the end of life care and having the discussion about what do you do? Do you try to do everything possible to save this person's life, or do you give them some dignity and some quality of life and let them,
Yeah.
die in a comfortable way? And my wife works in healthcare, and so she sees both sides of this. She's a social worker in oncology, and so she has to see this all the time. Like, there are doctors that are extremely rigid about their Hippocratic oath and interpret it in a way where they will fight tooth and nail to let someone go into hospice care and get the kind of care that they need for comfortable end of life, to the point where the person's suffering mightily, the patient's suffering dramatically. And then you have the palliative care doctors who tend to be more flexible in their thinking, by the way, who, I think that's their job, right? Is to sort of fight back against these perfectionistic, rigid doctors sometimes and say, look, you did everything you could. I promise. Like, this is not good for the patient anymore. Let's just give them comfort, let them go comfortably into that good night. And it's amazing how rigid certain physicians can get about this, because they're like, nope, we can still do this, we can still do this, we can, and I think that's an example like the pool where they're kind of undermining the principle underlying the Hippocratic Oath because they feel they have to do this, whether it's a fear of failure or it's a fear of not following the rules, fear of litigation, whatever it is.
Yeah.
Sometimes people just feel like this is the way the world works. I should do this.
Yeah.
There's the should statements.
Yeah.
A psychologist named Clayton Barber, who's since passed, used to say, stop shoulding all over yourself,
Okay.
right?
Yeah.
Because we get sort of imprisoned by these should statements, and that would be an example.
So if I hear myself thinking, this is how the word should be, that should be a warning sign to me, Greg.
Yes, you should not use should. Exactly.
Yeah. Actually, that stuff. I'm trying to think of an example where I've seen that clinically, but I see that loads in meetings where people believe that the world should be a certain way, that teams should be in a certain way, that finance should be, and sometimes it's me in those positions as well. And you kind of you think the world should be in a certain way, and then you keep pushing that agenda, and then it goes nowhere, and you don't get what you want anyway, and then you end up being so far off from what you actually want that you kind of think, hold on a second, is we went down this road how the word should be, but actually we all wanted to be here, but we kind of were
Yeah.
over there. So I think that happens a lot in kind of leadership and team working, perhaps as well as maybe the clinical scenarios.
Absolutely. In fact, when I go and talk to organizations, the thing I really try to pound home is this idea that perfectionism absolutely stifles creativity and innovation.
Mhm.
I mean, I can't think of much that actually gets more in the way of creativity and innovation. We get stuck on a hamster wheel, and we're doing what we quote unquote should be doing,
Yeah,
and we can't think outside the box. We get really stuck. And one of the best ways of fighting that stagnation is to really fight perfectionism.
yeah, yeah. Okay. Tell me a bit more. What do you mean by that?
Well,
Yeah,
so how do in order to get off the hamster wheel,
yeah,
and you got to see the world outside of this should world,
yeah,
right? This shouldy world of, doing things that you think the world expects, and sort of a formula for what's to happen. And
yeah,
if you want to do anything creative or innovative, anything that seems to have even a semblance of risk, you got to be willing to step outside that formula.
So
right? And
how does one get there? How does one step out of, there's the mind saying this is how the world should be. How does one get out from that?
excellent question. One is to first recognize that it's happening. The second is to have a culture in which that's called out gently, and that you have a world where they call it this new phrase. I don't know how new it is, but it's like fail forward. Have you heard this before?
Tell
Yeah,
me.
it's
Yeah.
it's cute. It's this idea of like, fail in a way that's um, quick and excessive, quick and frequent, so that you can then learn from it and grow and move on. This is sort of an entrepreneurial concept.
Yeah.
And
Yeah.
the problem is no one ever tells you how to fail forward, right? They don't like it's a nice little hollow cliche, but no one ever tells you. And I really think you can draw from principles on treating perfectionism to fail forward with grace and learn from it. And
Yeah.
one of those strategies people think is absolutely bonkers, but I tell people, use exposure-based treatments, exposure therapy,
Yeah.
which is the hallmark approach for fear and anxiety. Evidence-based, 85-90% of people who do these kinds of treatments tend to show tremendous clinical improvement. Why not leverage some of those principles for this? And so I tell people to make mistakes on purpose.
Okay.
And it blows people's minds. And we don't do huge things. I'm not like, go to implant a sponge in purpose on a surgery patient. Like it's not exactly that crazy, but send an email with a typo, sign off your name incorrectly,
Okay.
right? Start small and work your way up. Send your
Okay.
email to Jim in receivables instead of Jim in accounting,
Okay.
right? These things that we've all done on accident. Now, people with perfectionism, this is killing them, right? Like they could like the concept of this is horrible, but for us, we're just like, oh, I do that on accident all the time, right? Like it's not a right. But from their perspective, you start to loosen up their
Yeah.
thinking around making mistakes. You
Uh,
start to loosen up this idea that you can step outside the box and take some risks. And it's not, and really it's about learning. They
yeah.
learn that it's not as big a deal as they thought it was. And actually, probably most important, they learn that they can handle the anxiety that's not going to paralyze
Yeah. Yeah.
them, right?
Okay.
So actually, when I have patients with severe perfectionism come in, that's the actual number one treatment that
Yeah.
we will indicate is let's do some exposure therapy and we'll start with them making mistakes.
Uh, okay. I have to say that's blown my mind, Greg, as well.
Exactly.
Okay, I won't follow that on purpose. So I'll probably wrap up now if that's okay. I'm interested in what would be, based on what we discussed, what would be your top tips for doctors, for physicians at work?
Well, I think obviously the best would be to buy a truckload of my books. That would be the number one thing that they
Of
should,
course. And
of
number two,
course, right?
number two, yeah,
Number two would be to bring me in to do some consulting. No,
yeah,
I
okay, well that's fine. So we got your books, perfect.
yeah. No, I think the number one thing they can do is to just start to self-assess and check in with themselves about whether this is something they struggle with and to learn more about it. The curiosity is probably the single most important thing I'm hoping to get out of the people listening to your podcast. Because if I can get them curious about it, then maybe they'll go and they'll start to do some uh, sort of soul searching and judging of what they're going through. And then I hope that they seek some help. Now, I don't think you need professional help to work on this. It's not necessarily a diagnosis or a clinical issue, but I do think that there are levels of this on the spectrum that get in the way and that you can do something about. And I don't think it needs to reach the level of a diagnosis. Now, if it does reach that level, I would strongly encourage people to go get professional help. There are people that work on this, and I would encourage people specifically to find a cognitive behavior therapist. If even more importantly, if you can find someone with experience with obsessive compulsive disorder, even though perfectionism is not the same as OCD. Not everyone with perfectionism has OCD, and not everyone with OCD has perfectionism. But those are the best trained clinicians for helping people with perfectionism because of the Venn diagram overlap between those two conditions.
Perfect. Thank you very much, Greg.
Happy to be here. Thank you so much.